is that the MCIU board revised the budget and for approval, and some of the programs that they revised were was early intervention state funds, pre-K counts, speech and language earned stipends, and the Head Start state supplemental program and Head Start federal funds. This revised budget is going to ensure continued or expanded services for families who rely on Head Start. So when I say revised, it's not revised bad, it's revised good. So that's just my information for today. And at our next meeting, I'll give you the next update.
Beautiful. Thank you so much, Anik. And so without any further ado, we want to turn it over to the presenters for today. Navigating Child Serving Supports, Behavioral Health and Developmental Disability Systems. And we have Charlene Artilio with us. And then Dina Scarsi and Amanda Hundley. So I will turn it over to our presenters today.
Thanks, Beth. Good morning, everybody. My name is Charlene Artilio. I work for the Montgomery County Department of Health and Human Services in the Office of Mental Health, Developmental Disabilities, and Early Intervention. I'm going to be talking to you about children's behavioral health services, and I'm just let you know ahead, this is a lot of information in a short amount of time, so I will make sure you have my email address for any questions beyond kind of what we're talking about today. Just to give an overview of our office, these are the topics we'll be hitting on, but our office is one of many program offices at the county. As far as partnership, we most closely partner on the children's team here with the Office of Drug and Alcohol, and that's for some braided funding for student assistance program. And then also with our Office of Managed Care Solutions, who is the contract holder for Magellan Behavioral Health. Which I'll talk a little bit more about that in a second. But generally our office, if you have questions or thoughts around like publicly funded behavioral health treatment services, so that's through medical assistance with Magellan Behavioral Health, mobile crisis and SAP prevention supports, I can help with all of that. Just to give an overview, because the system can be a little overwhelming to navigate. I think it's sometimes the situation where if you don't know like what questions to ask, it's hard to get to the next point. So just to kind of lay it out with some of the things that kids have access to. So the first thing is in Pennsylvania, any child who has been diagnosed with a developmental disability, emotional, behavioral health need, medical condition are eligible, the family's eligible to apply for medical assistance, even if you have private insurance. And what that does is that it kind of just expands the types of services that are available to the child, and then also can help offset the cost of some of the treatment. So this is available regardless of parents' income. It's really just, based on that determination of that disability. Now, all of the medical assistance that's through the Montgomery County Assistance Office, which is state, and that is, there's offices in Norristown and Pottstown, but then also there's an application online at Compass. I'll talk in a second about a helper, administrative case managers who can help with that application process, because it can feel overwhelming, especially if it's your first time kind of like looking at the application. It feels like a lot of information. So the ACMs can help with that. I mentioned to you Magellan Behavioral Health. So the state has these health choices funds that are then disseminated to counties for contracting. So again, in Montgomery County, our Office of Managed Care Solutions contracts with Magellan Behavioral Health. So for those behavioral health services, so they're a behavioral health managed care organization. So ultimately, if your child has medical assistance, Magellan is the insurance, the payer for services, and can be that support for questions, concerns regarding kind of navigating their system. They do not provide direct care. They are contracting with other providers. And so here's just information about how to contact them if you need. The other thing that I want to point out too, because I mentioned our office is really kind of more hands in with the public side is if you have private or commercial insurance, the best place to kind of get that information and navigate providers, what's available, is by contacting that number on the back of your insurance card. But we also know that there are situations where somebody might not have insurance, or perhaps someone is just in a lapse or maybe undocumented and not able to apply for those benefits. And so there is county funding available to help to cover the cost of certain services and programs through our community behavioral health centers. And I will share that information in a moment. Before we roll into like just services, I do want to talk a little bit about Act 65, which is consent to mental health treatment. I think sometimes there's questions about, based on the age of a child, who can and can't consent to that child receiving treatment. So just to kind of say it in this way, there's outpatient care, which is considered like outpatient, wraparound services, family-based, those community-based services. And then there's the inpatient levels of care, which are like 24/7, so residential and inpatient. So youth ages 14 to 17 can consent to their own inpatient or outpatient treatment. So they can do that, they can access that on their own. Also, in addition, a parent or a legal guardian can also consent to the parent or to the treatment for that child, ages 14 to 17. And whoever is consenting is also controlling the release of records. I think sometimes even like within the professionals in the field sometimes have like a misunderstanding about what Act 65 means. And if a child isn't consenting and their age is 14 or older, that means that the family can't access treatment. That's not true. There are certain levels of treatment that do require authorization or a physician, like inpatient, to authorize that level of care. But working within the system, there is that flexibility. And this is a really important point, especially, if a child is in need of inpatient care and isn't willing to consent, that means a parent can also consent. And what this does is, it's then a voluntary admission into treatment versus involuntary at 302. And 302s can have long-term implications for a child as they get older and they're navigating the world, depending on what job they might want. We do the best that we can to kind of reduce the numbers of 302s for kids. And then there's more information about the act that you can kind of dive into, but this is the general overview. I mentioned community behavioral health centers, CBHCs. These are important. They are regionally located. They are your hubs. So they have an array of treatment. They do evaluation. They have case management services, medication management. They're your go-to if you are just kind of navigating the systems and have questions. There is freedom of choice. So they are regionally located, but you can visit or connect with any of them across the county, and they'll be able to help navigate, services. Prior to like digging more into those services, I do also want to point out that mobile crisis is available across the county for anybody in Montgomery County. It doesn't even have to be a resident. If you're visiting, if you're a family member, and if there's any type of crisis situation, behavioral health crisis situation, mobile crisis is available 24 hours a day, 7 days a week. They can provide telephone support depending on the need. They can also come out into the community and meet a family. But their job is really to help with that crisis stabilization and diversion. But then also, if it is a situation where somebody might need a higher level of care, they can help navigate that. So they are your go-to with kind of, in those situations. And one of the things I love that the director over there, Maura Tomoti, says is like she wishes she could this could be called like having a crappy day service, because like what a crisis is really different for all of us. And so they are there to support that. So that's available no cost to anybody in Montgomery County. It's getting back to kind of like the more traditional line of services with continuum of care. I won't go through all of this because there's just so much nuance to all of these services, but just acknowledging that there are outpatient services going up through in-home services that can go in home, in community, in school, up to, acute inpatient hospitalization. Generally, what we see is that support, that inclination towards looking at the least restrictive level of care before those higher levels might be accessed. But if you have questions about any of these, you'll have my email address and we can connect. I mentioned at those CBHCs, the Community Behavioral Health Centers, administrative case managers, these are your go-to. So the ACMs, that's a county funded position to help families navigate. They're kind of like a touch point to navigate services in your region. So they're experts in that area. They can help with medical assistance applications. I know, sometimes there's questions about how to start with intensive behavioral health, IBHS services, wraparound services, right? Those ACMs can really be the point to just kind of like ground and organize, a plan around how to move forward. If additional like longer term case management is available for a child who has medical assistance, blended case management is able to provide that support on a more long-term basis, meeting a couple times a month, having more specific goals around education, job, social support, right? Like it's kind of a more focused long-term availability. I also want to point out this cool service that it's probably about a year old at this point, Nurse Navigator. So Nurse Navigator is available through Child and Family Focus, and it's case management for kids who are experiencing behavioral health needs, but also have physical health needs or are at risk for physical health. And actually this slide, they just changed the age. So it's available for anyone ages 0 to 26 with medical assistance. And they're really helping with reducing those gaps in care and helping with the communication between those systems. So an example I like to give is, sometimes we're navigating like medication shortages, right? And so like a nurse navigator would be able to help a family find that medication, just kind of like organize that treatment. So just keeping that in mind as a case management that's available across the county, but it is hosted by Child and Family Focus. All right, other supports that are available at no cost. I mentioned this in the beginning, our Office of Mental Health partnership with Office of Drug and Alcohol is Student Assistance Program services. So in the state of Pennsylvania, schools are mandated to have a student assistance program, like a core team process, and that's a place where referrals can be made for any child that is exhibiting barriers to learning that are kind of connected to those behavioral health needs, drug and alcohol needs. So our offices or the county provides county funding to district or to providers to offer district services. That includes screening. So that's an opportunity for a family to talk with a SAP liaison, share kind of what's happening. That liaison can make recommendations and connections to community-based supports. There might be some county-funded services that are available in the school. There's also support for parent-teacher consultation, short-term psychoeducational groups, or one-on-one support. So like what that looks like is really contingent on what the process is for each school or the availability. But this is a service that is available. And so that's the breakdown of schools. And so we have Aldersgate, Creative Health, and Marikey that are serving all of the districts. The other kind of resources that I want to point out that are of no cost are the Youth and Family Support Services. So Family Works is a county funded program that is available. It's really cool. It's parents and caregivers who have navigated multiple child serving systems. So mental health, juvenile justice, children and youth, right? And so they have this collective experience and can offer, support to other families who are navigating similar situations. So collectively, they can kind of provide that peer support. They do offer the one-on-one support, but then they also have a support group twice a month. That's just a really nice opportunity for parents who are just, looking for support or interested in support from other parents to build that network. This is also a support that I think is really handy to like have in people's back pockets, because just recognizing that there are wait lists for services. So if you're a person who's looking for services for your child, whether it's outpatient, intensive behavioral health services, family-based, you may encounter a wait list. Because right now, the field is in an interesting place with staffing shifts and then also just higher levels of need. So Family Works can be a nice support during that time, where somebody might be looking for more clinical oriented work, but have the support while they're waiting. NAMI Montgomery County, so the National Alliance on Mental Illness, that is our kind of chapter in Montgomery County, is made up of volunteers, but they also offer an array of different groups and supports for parents and caregivers. They also provide some in-school support, like, with mental health wealth prevention programming. So they do a lot of different things. It's so much that I would recommend just hopping on their website to get an idea of what groups are being offered, because of the volume of support that they're able to provide in a community. Another cool thing, I think this is just like one of those things that doesn't hurt for all kids to have in their phones, is the number for Teen Talk Line. So Teen Talk Line is a warm line. It's a peer support. So other teens are on the other end of it. They're supervised, that are providing support to any teen that's 12 and older, who's either texting, calling, emailing, with whatever topics, they want to talk about. And it's probably not a surprise that the more frequent topics that they're connecting around is like relationships. So whether it's family, friends, they're starting a date, that's what teens want to talk about. And the calls are private and anonymous. So they just have that connection. It's 7 days a week from 1 to 9. And then the nice part about Teen Talk Line is it is also offered alongside by the same organization, Access Services, as Mobile Crisis. So if there is a situation that just rises above what Teen Talk Line is really designed to support, the youth can be connected to Mobile Crisis. The other thing I want to say too about Teen Talk Line is this is an opportunity for kids who might be interested in volunteering and just learning more about the helping profession. So if you have a kiddo who's looking for volunteer time, or just interested in learning about that support position, they can also get in contact with the same information and volunteer with Teen Talk Line. As I mentioned, it's supervised. The kids learn about motivational interviewing, right? And they're kind of like supported in that skill set. The last few things that I want to point out to you are our updated resources. So as I mentioned, there's a lot of information. This is a very quick version of like who to go to, your administrative case managers who can help navigate the system. We do have a children's behavioral health guide that outlines all of the clinical levels of care, and the support services. So clinical levels of care being like outpatient, family-based, multi-systemic therapy, partial hospitalization, and then the support services like Family Works. There's peer support, transitional age youth peer support. There's who else? NAMI, all of those things. There's a summary of that information in the Children's Behavioral Health Guide, along with like contact information for Magellan. So it's your go-to if you're just trying to orient yourself with county services. The other pieces available is our SAP brochure, and it just lists that contact information for student assistance program providers and gives a little bit of information about what SAP is. So there are the links that you'll be able to access from the PowerPoint once it's set out, to view those documents. And again, I'm always happy to send them if you would like to shoot me an email. And also in the guide, in the PowerPoint as links are just more specific links to our various offices. So we do a lot of work with social emotional learning, with grants, and supporting districts with programs like Second Step, which teaches those social emotional, like those soft skills, those competencies. There's a suicide prevention task force that hopes like that hosts various events or meetings, just kind of talk about that suicide prevention. So there's a lot happening at the county. I'm gonna throw up my email address, which has all the letters in the alphabet at the bottom of this, that you can shoot me an email, but I'll also put it in the chat just so it's easy for you to access. And I just thank you for your time. I'm sorry, I know there was a lot of information in a short amount of time, but don't hesitate to reach out if you need anything. Thank you.
And Charlene, can they start by just contacting you? I mean, there was
Yeah.
a lot of information.
Yes.
We'll share this on our website, but I want you to understand that Charlene attends almost every local task force meeting and is extremely responsive to email. It's overwhelming. Start with Charlene. If you're wondering as a parent, what services can I access based on the county? Do not hesitate. You see how many things that there are. Anique put a million things in the chat, which is amazing. So please make sure you make a note of that email. And Charlene's a great person to start with. Perfect. All right, I'll turn it over to Dina.
Good morning, everyone. I'm Dina Scarcy. I'm the intake coordinator with Montgomery County's Office of Developmental Disabilities. Now, I forget, did I share my presentation or do I need to do it here myself?
You just need to share it if you
No, I know how to do it. I thought I had sent it in, so I thought someone else was controlling it for me, but
you
that's
can
fine.
the nice thing is we allow you to control things here yourself.
Well, thank you. Yes, thanks.
Thank you, Dina, for being here.
Just checking. Might have been something else I was thinking about, but
no worries.
yeah, I appreciate it. So like I said, I work for Montgomery County's Department of Developmental Disabilities. I'm one of the 2 intake coordinators. So what our main function is that we verify eligibility for services through the Office of Developmental Programs. So that's the state. So that's our state office. We also qualify and monitor providers of services. We ensure individuals' health and safety through risk management. We do community outreach and education. We also review, approve, and authorize individual support plans. So that's a plan that is developed when someone is registered with our office. Now, we do work with multiple individuals with different types of diagnosis at this point. So each one has its own eligibility requirements, which I'll get into. If you have an intellectual disability, what we look for in order to register with our office is a psychological evaluation. It would have to document the intellectual disability diagnosis, as well as a full-scale IQ score of about 70 or below. The documentation would also have to include a adaptive assessment, which is used to show that the individual has significant limitations in at least 2 areas of major life activities. So that's kind of day-to-day living, things like communication, academics, health and safety, and so forth. The evaluation does have to be signed by usually it's a school psychologist that we use. And if by chance, I know that we're talking with more of a student base, but just an FYI, people can register over the age of 22 if they don't have any documentation prior to the age of 22. They can still register, but there needs to be some sort of clinical opinion by the psychologist that the intellectual disability has or was present during the developmental period. So not like a result of, say, a medical condition like a stroke or a traumatic brain injury. Next, you can register with a diagnosis of autism. This would be without the intellectual disability. So first, you would need medical assistance. Second, we would need that psychological evaluation. It would have to document autism as a result of some sort of diagnostic tool or assessment. So we usually see autism rating scales and things like that. They also need the significant limitations in major life activities through that adaptive assessment. They actually need 3. The evaluation does have to be signed by the psychologist as well. And they would also need a medical evaluation. So this is just a physical exam. The physical does have to document what we refer to as a level of care. The level of care is called ORC, which is other related conditions. So we would actually provide you. So when someone reaches out to us, we send an email and I provide you with this medical evaluation as well as an explanation to this requirement. So you can give that to the physician so they understand, why they're checking certain boxes on that physical form. You can also register with our office under medically complex conditions. First requirement would be medical assistance. Second would be this is age related, so it's from birth to 21. Here, I would provide you with a medical form that you would give to the physician in which they would document that the individual has chronic health conditions that affect at least 3 or more organ systems. This individual would require medically skilled nursing intervention in order to support them. We would also need that medical evaluation recommending that level of care. And also they would have to show the significant limitations in at least 3 areas of major life activities. Excuse me. And then lastly is children age 8 or younger who have a developmental disability. So first they would need medical assistance. This also has the age requirement of a child 8 years of age or under. What we're looking to document here in the evaluation would be the developmental disability. The kind of key to this is it would have to have a high probability of manifesting into a intellectual disability or an autism diagnosis after the age of 8. They would also have to show the significant limitations in at least 3 areas of major life activities. The evaluation would have to be signed. And also that physical evaluation, physical evaluation recommending that level of care. So what happens?
Quick question.
Yeah, sure. Sorry.
Quick question. There's a question that says, while the reports document the disabilities, families are often told the school's scores are not current enough. What's the department's current position on the date of the testing?
So for intellectual disability, usually if the IQ testing has occurred after the age of 8, we will use it. There's always, sometimes there may be some concern around terminology or language in the report, and that may be why we're asking for some additional information. For autism, because that's typically diagnosed fairly young, if you have a report from CHOP and it was completed when your child was 2 or 3 and your child's 15 now, we'll use that report. Obviously, we have to get updated adaptive assessments because that has to be more recent to show that they do have the limitations. But we typically over the age of 8 for someone who has an intellectual disability, and with autism, it can be fairly young. So.
Wonderful.
Okay. So for the registration process, folks typically contact me. That's because I've been around forever. So my name and number is out there. This is, you can obviously email me, but right now this just has my my phone number here. Direct line to me. So, I do try to pick up when you guys call. We'll have a discussion regarding the diagnosis, and I'll kind of explain once again what's needed. And then it's up to the parent to submit that information to us. We do a review of record and then usually communicate that it either meets the requirements or what we may need in order for it to meet the requirements. If the evaluations do meet the requirements, we then schedule an intake meeting. So the intake meeting is going to be with whoever you're working with. So it would be either me or my coworker, Megan Disk. The intake meeting is really kind of like a brief overview of who we are, what we do, and what to expect next. So this is where we give families more information regarding waivers, the waiting list, services. This is also where the individual and family select their supports coordination organization. so what the supports coordination organization does is they're your case managers. We call them supports coordinators. So they are there to essentially help you navigate our service system. Their main role is to coordinate, locate, and monitor services. What happens though, initially when someone's registered, you're not immediately getting funding. So it kind of depends on what services are needed. The fact that someone is under certain ages do play into to whether we are the primary funding source for those services. So sometimes a supports coordinator acts as a resource person or helps guide families in how to go about, saying, getting behavioral health services. What does happen is when it's time for our services, our funding to provide services and supports, it's that supports coordinator that helps you coordinate they essentially, once the county says someone has funding, they're going to assist you with finding providers, coordinating the services, and now you'll hear from them a little bit more often because they monitor services. So, they're essential to this whole process of working with the county in order to get funding and services and supports. I'm going to kind of jump back here for a second. So,
Dina, there's a couple questions.
Okay, yeah, I can't. Yeah. I think my screen's too wide here. I'm not seeing the chat box.
No, you're okay. There's a question. How long does the process take to get approved? And is there a waiting list?
So there's not a waiting list to register. So we kind of do things as we receive them, to be fair, on the order that we receive them. So that's kind of a hard question because it's it could go as quickly as how quickly we get the information that we need. So if you submit an evaluation and it meets all those requirements, the turnaround, so technically we have up to 14 days to review an evaluation. I can't speak for Megan, but on the whole, I don't think we take that complete 14 days to review. Usually once we know someone meets the requirements, we do ask for like a copy of like a birth certificate, social security card, medical assistance. That's done within a secured email. So like, once again, if the turnaround and us asking and getting what we need happens quickly, then the whole intake process can happen pretty quickly as well. So, you could be, intake within say six to 8 weeks, depending on how quick we get the information that we need as well. Now, go ahead, I'm sorry.
No, yeah. I think that gives an approximate timeline. I think that's helpful. Now, there's a question regarding what is the targeted age you should apply. Some people are told 14, but I see that another question in the chat is, what services can families, children 8 or younger access? So the question is there an age you should register, or should you register immediately upon having a disability type such as this, Dina?
So you can register at any age, I think. So once again, you get supports coordination services. And that's because our funding, which we refer to as waivers, are considered the payer of last resort. So it's the short term for Medicaid Home and Community-Based Waiver Program. So when you have children who are under the age of 21, they do have other service systems available to them. So the waiver can't fund something that, say, medical assistance is supposed to fund or the school district is supposed to provide. So there's these kind of fine lines around certain things. Some of our services have a strict age requirement. You have to be 18 or 21 to be eligible for the service. So, the benefit of registering is that supports coordinator, because they can help the family with resources and guidance on, how to obtain certain services and supports. I would say, you would want to definitely register, let's say it that way, between the ages of like 14 and 16. Because you want that supports coordinator to be part of that planning process of what's going to be needed when someone ages out of school. But you can essentially register at any point. And what you definitely get is that supports coordinator.
Perfect, Dina. And last question, which is a compilation of one, is for the IQ testing, if the school conducted it, what do you recommend for documentation? Is that all conducted? Is that within the school? Is that an IQ test, a WISC? What is that you look for specifically?
Yeah. So yes, exactly that. So it could be a WISC, a WACE, can be a CTONI if someone's nonverbal. So like it's we kind of default to the psychologist. They're the professional. But typically that's what we see. You know, it's a CTONI, a WISC, a WACE. With an intellectual disability, the majority of the reports also have that adaptive assessment because it's needed to essentially diagnose. I know school districts don't diagnose, but it's, you know, determining eligibility for special education services as well.
How recent do those adaptive behavior scores need to be? That was
We like
another
it to be
question.
within 5 years. Yeah. So
5 years.
the other thing too is we do have the ability to send it out to a family to complete if it is, say, a little bit too old in the reports, or maybe it's not showing the limitations, the significant limitations. So we do have the ability to send it out and have it completed by a person who knows the individual well, which is usually the parent. So.
And last question, is it, I know you touched on this before, is that IQ score, it has to be 70, or is there some flexibility as far as how the standard error of measurement, you know, how do you?
Right. So they refer to it as a conference interval. So it can go, it gets a little
Maybe
tricky
Amelia. Maybe
with
take a
the
look at
school
Amelia, unless
reports
you said
because,
Amelia for now.
once again, they're not
Yeah.
diagnosing, they're determining eligibility
Will you
for
take a look
special.
at Amelia today? And Masai, how's
So
everything with you?
Good.
Good.
Yeah, I was gonna
typically an IQ score can go as high as 75. So it has that plus or minus 5 points, meaning that if I score 70 today and take it within the next year or two, I can go down 5 points, I can go up 5 points. With the school, though, because it is, they're not diagnosing. I think if something was a little bit higher, like a 75, we would want more of a psychological evaluation, since the school districts don't usually use the terminology diagnosed with. So if the school psychologist clearly, you know, provides a diagnosis, we could use the school reports as well.
All right, we'll let you continue, Dina. Sorry, there was just a flurry of questions, and we'll work in the other ones as we go through. Thank you, Dina.
Yeah. So what happens after you kind of leave the intake and move on to the supports coordinator? That supports coordinator kind of meets with the family. They develop that support plan. They document needs for services and supports. I'm not going to get too much into this because that's why Amanda's here. They put them onto the waiting list, which is called a PUNS. And then when it comes to like, when am I going to get services? That's kind of based on the county's availability of funding, and we do prioritize people based on need. So that's kind of, there's, when you're told, hey, everything meets the requirements and you can register, it's registering. It's not saying that you're getting funding. That request goes through the supports coordinator. We talked about that. This is the individual support plan. Like, once again, I'm going to leave this kind of stuff to Amanda from the ARC Alliance, but the supports coordinator does develop a support plan. It's designed to be person-centered and essentially provide information regarding what the individual's abilities are, what they may need assistance with. It also focuses on, you know, what makes sense in their life, what doesn't make sense, what's important to them, you know, their dreams, goals, aspirations, and things like that as well. So the PUNS is that waiting list. It stands for, sorry, the prioritization of urgency of need for services. The PUNS, once again, is completed by the supports coordinator, you know, after meeting with the team and identifying the need for services and supports and how urgent that need is. So when we prioritize people, you're prioritizing them based on need. So if someone registers at the age of 10, that does not make them higher on the waiting list, because our waiting list is based on need. So we have 3 categories. An emergency need is services are needed within 6 months. Critical is 6 months to 2 years, and planning is 2 to 5 years. So like an example of planning would be if a student is, say, 17 and they're aging out right before their 22nd birthday, and you're documenting the need for the services upon their exit from school. That could be planning, so it gets reviewed annually with the family and the individual. The different types of funding that we have, we have 3 waivers. We do not manage the autism waiver. Someone who's registered with us has access to the person family waiver, community living waiver, and consolidated waiver. Person family waiver as it is now is capped at $47,000. Community living is $97,000, and then a consolidated waiver is uncapped. So this is a fiscal year which runs July 1st to June 30th. So just an FYI, when you apply for funding, you're not applying for, say, a consolidated waiver. The waiver that someone receives is determined by the county, and it's going to be based on what are the services and supports that are identified, and how much those services cost. So if someone needs, say, residential services as an adult, that would be a consolidated waiver. Or if someone is medically complex and they're aging out of nursing services through medical assistance when they turn 21, they would also be someone who would use a consolidated waiver because they have an immediate health and safety risk because of their medically complex condition. So, in terms of the waivers, you can go from one waiver to the next over someone's lifespan. So maybe, your child graduates and they could receive a person family waiver. Maybe a few years pass, maybe 10 years pass. They now need, say, additional services and supports that require a community living waiver. That supports coordinator would identify that need, place them onto the PUNs. You continue to receive the services you have under your person family waiver as you wait for another, waiver to become available. So you do have the ability to move from one waiver to the next. I know I make everything sound super easy. Of course, there is that waiting period for services, for funding for the services that someone may need. These are just an outline, I guess, of the services and supports that someone can receive. So I mentioned being 18 or 21 to be eligible for certain services. So you have like behavioral support, nursing services, any type of like therapies like PTOT, speech, 21 and older. So there are some age requirements to certain services, but these are pretty much the services. Get recycled. Apologize. I know. Sorry about that. Some resources. So for us, the County Assistance Office, Social Security, OVR, the Office of Vocational Rehabilitation, they help individuals obtain employment. Voter registration and assert related to autism. We have my contact information here. So here's my email. My coworker Megan Disk, you can email me initially. If Megan's going to be the person that follows you through, I'll provide her information to you guys at some point. You'll receive her information. You can call, you can email, whatever's convenient for you guys. And then, is there any more questions?
I think a lot of the questions were regarding supports coordinator.
Okay.
So that Amanda Hudley will cover that.
The
And question, there was another question in the chat. How many people are on the waiting list typically? Like what do you?
Amanda will probably know this better. I can typically say the emergency, and so I believe within Montgomery County, there is roughly about 400 people on the emergency waiting list. So that's the folks that need services within 6 months. Yeah, I'm not sure like statewide. I know there is a website out there, but I haven't checked it in some time.
So 400 people
for emergency need. Yeah.
Okay.
Roughly.
Okay.
Yeah. Roughly.
Thank you so much, Dina. And we'll put this all in the on our website. And Dina, lots of information.
Yeah, just reach out. Like Charlene said, just give me a call, just email me if you have any questions. we're pretty responsive as well. So just reach out and we'll definitely get back to you, and help you along with the process.
Thank you so much, Dina.
Yep.
We'll turn it over to Amanda. Well, you're asking great questions. I try to work them in, as we go along. So keep them coming, and I really work hard to. And we'll do question and answer after, too, so that if it didn't get covered, you can have the opportunity to ask then. So Dina, don't leave us, and Charlene, don't leave us, because we'll get any lingering questions at the end. All right,
All
Amanda.
right. Is everyone able to see my screen?
Yep, perfectly.
So as the other presenters mentioned, I'm going to be going over a lot of information in a very short amount of time. So if anybody either here or anybody knows someone that wants more information, I do have my contact information on the last slide, so people are more than welcome to reach out. It's typically easier for me to respond to specific questions via email, just so that I can send, resources and information. But phone or email is totally fine. Okay, so just a little bit of information about the ARC Alliance. The ARC Alliance started out as a grassroots movement in 1951. Several parents came together and agreed that they wanted more for their children with disabilities, and they didn't want to see them institutionalized. They wanted their children to be included in the community just like everybody else and have the same rights and choices as everyone else. And the organization kind of grew, and it became what it is now today. And every state has an ARC. There is a national ARC. Every state has an ARC, and most counties have an ARC. We all follow the same overarching mission, but each ARC is independently owned and run, and they typically do different things within the disability community. So like there is like the ARC of Chester County, but they do different things than we do. So for us specifically, we offer early intervention services, which is birth to 3. We also offer community services, which is guardianship. So when someone has a disability and is not able to make decisions on their own, we have staff that can be someone's court-appointed guardian. And our foundation department is community outreach and fundraising, and advocacy services is supports coordination, which I'll be going into more during this presentation.
Amanda,
Yes.
how many support coordinators are there in Montgomery County?
I'm sorry, what?
How many support coordination services are there in Chester County? In Montgomery County?
I don't know off the top of my head, but when you sign up through the county, like with Dina or Megan, they will give people that qualify, they will give a list of all of these supports coordination organizations that are currently open and accepting new intakes. So, for example, right now, we are not accepting new intakes at this time, but Dina always gives a list of, the most up-to-date list of the agencies that are accepting intakes.
Well, and you can go outside the county, is that right as well, Amanda?
As long as they are registered with the county. So, for example, we serve the entire Southeast region, so Bucks, Berks, Chester, Montgomery, Philadelphia, and Delaware counties. So supports coordination organizations can be registered with several different counties. So as long as you can choose one that is physically located outside of your county, as long as they are registered with the county office that you live in. Does that make sense?
That's perfect. Thank you
Okay.
so much.
Do you want me to also keep the chat box open, or do you want to relay questions kind of as they come in?
I'll try to relay as they come in and work them into your presentation. Is that okay with you?
Yep, that sounds good. So just like any other system, there are a lot of acronyms and words that are specific to supports coordination and the IDA world. So some people do use intellectual disability and developmental disability kind of interchangeably. ID and DD. And SCO is a supports coordination organization that the supports coordinator works for. An ISP, or individualized support plan, is similar to an IEP, but it focuses more about daily life rather than academic levels. So as Dina reviewed, and I'm not going to go, super into this because she already reviewed this information, but essentially, in order to be eligible for supports coordination, the person has to have a diagnosis of either an intellectual disability, autism, developmental disability or delay if there's age 0 to 8, or be a child under age 21 with a complex medical condition or medical complexities. And it is also recommended that everyone be enrolled in Medicaid insurance, because that is how supports coordinators bill for their services. You are not being billed directly, they bill Medicaid. And people, as Dina mentioned, people can have private insurance and Medicaid at the same time. Generally, in terms of registration, as Dina mentioned, age, between 14 and 16 is ideal to register, because then that way the supports coordinator can work with the person and the family and whoever else is part of their life to help them transition from, the school system into the adult system. So here are I know this covers more counties, but so these are all the counties that the ARC Alliance serves. These are all the intake phone numbers. And so to start the registration process, again, as Dina went over, you would contact your county IDA office, submit the documentation that Dina or Megan will let you guys know about. They determine eligibility, and then that person is given a list of all the qualified supports coordination organizations in their county. They choose one. If they want to call around and talk to the agencies to make a choice, they can. As I mentioned, I did make a questions list that I can definitely share, so that it can be, relayed to all the attendees, if they want to use it when choosing a supports coordination organization. Once someone chooses a supports coordination organization and they are registered, they have the right to change at any time. So if anyone is ever unhappy with their supports coordinator specifically, they can contact their SCO and request a new SC. Or if they are unsatisfied with the SCO as a whole, they could contact the county office and request an SCO transfer. And then somebody at the county office will then give them a list of all the agencies that are accepting transfers.
Amanda, a question was asked, how do you know if the person's the right fit for you, a supports coordinator? Is there something that helps a family know that they've got, that the chemistry or that the relationship is a positive one?
I would say the feedback that I have gotten the most, because I also handle a lot of our customer service calls, is that just like the responsiveness of the SC. So one question that might be good to ask when you are calling around is, does your SCO have a policy for returning emails and phone calls? Because there have been some families that I've heard that say, oh, I'm with, XYZ agency, and I've reached out and asked questions about, my daughter needs services for whatever, and it's been, 3 weeks and I haven't heard anything. So yeah, I would say that's the most common feedback I get. But Yeah, I mean, I think, like I said, I had made that question sheet, so I think using that can kind of help families get a better idea of who's going to be the best fit. And like I mentioned, though, you're not beholden to one supports coordinator or one SCO. So you can definitely, ask to change.
Perfect, thanks.
Mhm. So once enrolled, a supports coordinator will be assigned, and then they will reach out to you to schedule the intake meeting, which can occur at your home or at the school if that's preferred, or anywhere that is convenient for you. And then the supports coordinator will write the ISP. And then once it is approved, it is then mailed to the family. Um, So very simply put, supports coordinators ensure the people that they support are healthy, safe, and have a good quality of life. And although we are not official, quote unquote, advocates, we do advocate for our people above all else. And SCs also apply for funding depending on need and help connect people to various supports and services. This can include things like skill development, employment, transportation, life enriching activities, among other things. Um, SCs act as the connecting bridge between the person and the disability service system and the services that are provided within that system. They also provide assistance by navigating other service systems and accessing and organizing natural and generic supports. So things can include things like SNAP, food assistance, foundations and companies that provide financial assistance, community social groups. It can really be anything. So the SC is not only navigating those Medicaid waiver funded services, they are also providing community resources and supports. This was also mentioned by Dina, but the SC's key functions are locating services and support that someone needs. This can include things like job coaching, transportation, summer camp, respite. It would also include natural supports that might be available, including, family, friends, neighbors, local community groups, things like that. Coordinating with the individual and team members, including family, staff, teachers, whomever's a part of that person's life, and service providers based on the individual's needs. Monitoring is a visit typically done in person, sometimes done virtually, to ensure the person's health, safety, and quality of life. And also, if somebody is receiving waiver funded services, the SC ensures that these services are being provided as authorized in the ISP, and any issues are documented and followed up upon accordingly. SCs advocate for individuals, lead team meetings. They can also attend IEP meetings. Typically, not so much when someone is very, very young, but when somebody's in high school, the SC can attend. Uh, they may not have a lot to contribute, but the point of them being there is so that they can get an understanding of where the person is, during that time, and then better help transition them from the school system to the adult system. Schools themselves will not invite supports coordinators. The family needs to let the supports coordinator know when and where the meeting is. So if you would like your supports coordinator to attend the IEP, please reach out to them and give them the information. SCs also coordinate the annual ISP meeting, which is where the entire team gets together and reviews the ISP to ensure that the plan is up to date and reflects the person's needs and or if their circumstances change, that the plan is updated to reflect that information. As students get closer to graduation, the individual or team determines what services somebody may need and advocates for them to receive a Medicaid-funded waiver. The SC assists the family and individual in completing all the necessary paperwork and guides them along every step of the way. The person may also be registered for services after they graduate high school, but they will need to show, that diagnostic information, as Dina mentioned. But typically, depending on the year, Pennsylvania does try to set aside some waiver slots specifically for graduates. It's called a graduate initiative. The amount of waiver spots available for that varies depending on that year's funding. But if you have a supports coordinator in your life, it's important to let them know well ahead of time when that student is going to be graduating, whether they're going to be graduating let's say early at age 18, which is not highly recommended, but it does happen, or at 21 or at 22, depending on that particular student. So as Dina mentioned as well, the waiver is a Medicaid program that pays for services for individuals with qualifying diagnoses. Unlike school, which is entitlement-based, the waiver is completely needs-based. There is a waiting list for waiver. I did put the link in the chat that shows the waiting list. So that's why registering for supports coordination when someone is in, is high school age, ideally, is really important, because then that also helps the state plan for how many waiver spots are likely to be needed. The waiver is payer of last resort. So meaning all other avenues of support and funding have to be exhausted before the waiver funding will kick in. Once a person receives waiver, the SC works with the individual and family to set up the necessary services. This is completely individualized and based on what the person needs in their life. And just as people's lives change on an ongoing basis, services can be added or changed throughout people's lives. For example, there was a woman living in a residential home, and she decided that she was ready to live independently. She worked with her SC and support team to implement a plan to transition into her own apartment with occasional support for cooking and money management. So the amount of services received and the actual services themselves and the agencies that provide those services can change throughout people's lives. So if someone does not have a waiver at this time, the individual, the family, the SC, people in their life can start looking at natural supports, such as family members, friends, neighbors, local agencies like OVR or United Way. You can also contact your local legislator to advocate for funding for the waiting list. You can go to the arcpa.gov to get more information about your local legislators and helpful information about items to include in conversation. Even if you don't have a Medicaid waiver, you can still receive supports coordination services. SCs bill for their services through medical assistance, just like when someone goes to the doctor. So nothing is coming out of your pocket. There are also other waivers available through other agencies, such as the Office of Long-Term Living. The ARC Alliance and other supports coordination organizations do not deal with these waivers directly, but can provide general information about those waivers and contact information if anyone was interested in exploring those other service systems. I did want to briefly touch upon, I believe I've talked about this before, but on our website, there is a page just about supports coordination services, if anybody wanted to explore that. And also that we also have a community calendar on our website. So this, you do not have to be registered with the ARC Alliance or any supports coordination organization. This is for like literally anyone who would like to do this. They're just activities in the community. Some of them are virtual, some of them are in person. One of my supervisees, our quality coordinator, spends a lot of time updating this calendar with a lot of different activities. So some of them are geared toward people with disabilities, some of them are geared toward family, some of them are for professionals. And then so what you would do is you would just, click on the event and, read more about it. And if it's virtual, there's usually a registration link in there. So yeah, this calendar is great. I encourage people to take a look at it and also to send the link to anyone who also may be interested and or benefit from the events that are on here. And then lastly, there is our office information and also my information.
Thank you, Amanda, so very much. And we'll put this information on our website as well. Just a few questions for all the presenters. Have you seen, or do you expect the changes in the government to change the funds available for assistance in the program? Have you seen any of that happening? Dina?
I have not seen anything as of yet. For advocacy purposes, our agency has been hosting legislative breakfasts. I think in like 3 or 4 out of the 6 counties that we serve, we are inviting legislators and individuals that we currently support and families to share their stories and kind of put a face and a story behind the reasoning why funding is so important. So far, I believe we've had our Montgomery County legislative breakfast and our Bucks County, and I believe we are currently working on Berks County. But yeah, and we also, our administrative staff is continuously reaching out to legislators and explaining why, this funding is so important. But as of impacts, as of right now, to my understanding, I have not seen anything, at least myself, but I don't know if Dana wants to speak to that or not.
Want to stop sharing your screen, then we can see each other, all's faces, and we see if Darlene, and thank you so much, Amanda.